Executive Director of the AIDS Project Los Angeles, and Dr. Martin Finn, who's the chair of the board of the AIDS Project. Bill, Martin, I'm so glad you're here with me today. Thanks for being here. I want to really start with just the basics. What exactly is AIDS, and who is at risk?
The immune system of the body is the basic defense mechanism of the body. It allows the body to physiologically throw off infections, bacteria, other threats to health. The individual who has AIDS has a defect in that system, meaning that he or she can't rid himself of those infections as you or I would. Things that you and I can throw off very easily, that person cannot.
We've all read about the headlines about the cause of AIDS. Now, what is this virus, and is it in fact the cause? Because I've heard rumors both ways. And how is AIDS transmitted?
The virus, it is hoped, because of the recent identification at the National Institutes of Health, is the major cause of AIDS. That is not to say that there could not be other cofactors which make this possible. Those susceptible would be those who have come in contact with that virus. And that would include certain high-risk groups at this time. The major one being gay, bisexual males, another category being those who abuse or use drugs, intravenous types of drugs. The hemophiliac population, because they receive blood products constantly. There is a Haitian connection, I think, as most people know. And then other susceptibles, including children at this time.
And how exactly is it transmitted? Can you explain that to us in more detail?
Well, at this time, and we operate on what we have learned over several years, it is transmitted mainly by sexual contact, that is the sharing of bodily fluids intimately and through the receipt of blood products, transfusions, etc.
I've heard many people say that since the cause is known, the cure is just around the corner. What's happening in terms of the research end? Is there, are they looking for a cure? Are they looking for prevention?
You have to go at this in a stepwise process. First, you have to identify the agent, and we hope that that is what has occurred as of May of this year. After that, then they can proceed to see what they can build in terms of a vaccine or a cure. It's not around the corner. It's not tomorrow. Most people feel that conservatively the first time we could expect a vaccine would be in the 4 or 5 year range. Cure, there's always the miracle that occurs, but I don't believe it will be this month, next month, or probably this year.
And a vaccine would be effective for people who hadn't been exposed?
That's right. The vaccine would prevent individuals from developing the AIDS itself, and it should be very clearly understood the vaccine does nothing for those who already have AIDS.
Well, there are probably no two people in the city who are more knowledgeable about what's going on in terms of AIDS in Los Angeles and in fact in California. Is this a crisis? Is it growing? Is it abating? Is it two crisis proportions?
Well, I think that it depends upon how you define the word crisis. Certainly the numbers continue to grow. We at the AIDS Project continue to provide services and education regarding AIDS and provide support services to people with AIDS. The numbers that we see of people coming in continue to grow, and the difficulty in giving those people assistance and getting support for them continues to be difficult. It's a crisis to us in terms of what we're doing. Yes, I think it is.
Okay. I've heard a lot about safe sex. I'm not exactly sure what it is. I've seen brochures, I've seen this and I've seen that. Can you, fairly graphically, if you will, but without being too graphic, explain to us about prevention?
About safe sex risk reduction methods? Well, I think the main thing that needs to be pointed out is that if people are engaging in sexual activities, they should refrain from any activity which would expose one person to another's body fluids or blood. It's really that simple, and you can take that and then interpret it any way you want in terms of what sexual activities you could perform. But it's just abstaining from taking anyone else's bodily fluids into your own body or being exposed to their blood.
What else can be done to protect people? What other kinds of things?
Knowledge. Knowledge is the most important factor in protection. And of course, that's a major activity of the AIDS Project Los Angeles. We have to educate the general public so their anxiety is not destructive to them, and we must give proper education to high-risk people so that they know how to modify their lives if possible.
Well, both of you have dedicated your lives to helping with this problem, as have many people at the AIDS Project. What exactly is the AIDS Project Los Angeles, and what kinds of services does it provide to the public?
Well, the AIDS Project is a nonprofit volunteer organization. We operate mainly with volunteers. We have a few paid staff members. Our purposes are twofold. We provide support services to people with AIDS and their significant others, friends and family. Those support services take many forms. We provide services in terms of food, shelter, transportation, psychosocial counseling. We have group, individual, all types of counseling. We have about 8 groups going on a week right now. We provide legal, financial, and insurance counseling. We have a religious advisory committee. We do a medical, dental, and obviously mental health referrals to a vast number of professionals which volunteer with us. Those are the support service side of what we do. The education side of it is mainly geared to let people know, in terms of the general public, the high-risk groups, as well as healthcare professionals, the real facts about AIDS as we know it today, and let them know so that they will be more informed and be able to take a more rational approach to the whole problem.
Let me ask you to elaborate on some of the services that you mentioned. You mentioned, for instance, the transportation services. Can you give me an example of how that works?
Sure. If someone comes in, someone calls and needs to get to the doctor's office at County USC, for example, at 10 in the morning, they call us and let us know. Hopefully we can have the call a couple of days ahead so that we will know. We schedule them on our appointment book. Our driver goes to pick them up, takes them down, and either waits for them or goes, makes another run and come back, pick them up. Obviously, that's just one side of the transportation program. If someone calls for transportation and the van is not available, then we call on our volunteers to get the person a ride to where they need to go.
What about the hotline? Didn't the AIDS Project itself start with a hotline? Is that true?
Yes, it started in October of '82. The hotline has grown tremendously. We're currently taking about 1,200 calls a month from concerned individuals, people who want to know, people who may be concerned about themselves, may be concerned about someone else, or in fact some people with AIDS who have already been diagnosed who need referral services.
And you mentioned also about educating health educators. Can you tell us a little bit about why that's so important and what the situation is in Los Angeles?
Well, up to this time we've had little real knowledge of AIDS. Fortunately, we have now the viral find. But any time that you have such a situation, anxiety is rampant. And so we have had to deal with anxiety in the general population, in medical providers, physicians, nurses, dentists, the whole spectrum. And then, of course, we have the anxiety of those who know that they are at risk and are sitting out there with an uncertain future. So that type of education has to be specific to whichever target group you're working with. It calls for a knowledge of techniques, and it calls for an understanding of the disease process also.
The absence of that education creates what we're finding today. People with AIDS go through tremendous discrimination and abandonment because people are ignorant of the disease. They are afraid that if you walk into a room with someone, you're going to come down with it, and to date, it's been fatal at some point. So people are very concerned about that. They're frightened. And that just makes it doubly hard on someone who is facing a serious illness, and yet to go abandoned by friends and family, it makes it that much more tragic. And that's why education is very important, because people need support when they're ill. And many, many people with AIDS don't get it. That's why we're there.
And that's what we'll be talking about in the next half of our show. I want to thank you both for taking the time to be with us here today.
Thank you.
And I want to say to the people out there that the AIDS Project Los Angeles needs all the support that we can give. For information about volunteering or about AIDS in general, you can call 871-1284, and the AIDS hotline number for Los Angeles is 877-AIDS. And outside Los Angeles, you can call 1-800-922-AIDS. We'll be back in just one moment. Welcome back. My guests for the second half of our program represent the other half of the AIDS and the AIDS Project Los Angeles story. With me are Colleen Johnson, who's the AIDS Project social worker, Jerry Clark, who is one of the many volunteers who gives time and energy to the project, and Chris Shahar, who is a person with AIDS. Colleen, I know several social workers, most of whom work for the county, and their caseload is about 40 to 50. What's your caseload at the AIDS Project?
Well,
A lot more?
we're up to 160. When I first came to the project, we had, there were 60 clients. And I thought that was quite a few then, but now we've got 100 more. That doesn't include people that have died, of which people die about 1 every 3 days. So a lot of our clients have died and been replaced by new clients.
Yeah. How many new clients do you see?
There's one diagnosed in Los Angeles, 1 every day. We probably have 1 a day coming through the AIDS Project. We have a few volunteers now that work with them and do intakes and help them because it's just gotten completely beyond what I can do, obviously, and get home before 9.
9? I mean,
Well, yeah.
Well, I don't know quite how you do it. Okay, a person comes in and maybe they suspect they have AIDS, or they do know that they've been diagnosed. They make an appointment with you. Well, then what happens? What's the process?
Well, sometimes it's real helpful for people because it's the first time they've had a chance to really talk. They've had people ask them a lot of questions and tell them things. They've had doctors poke and prod them, but they haven't had a chance to really sit down and talk to somebody about how they feel. We ask them about what their diagnosis is, what it was like, how's it been since then. Were they in the hospital? Some of them have been in the hospital for weeks and weeks. Sometimes we go out to the hospital to interview people because they're too sick to get into the office and they need help right away. Sometimes we go to people's homes, which can be a real eye-opener. Sometimes you realize that people don't have anybody helping them and they're in desperate need of help, which you wouldn't have known if you just talked to them on the phone. We do an evaluation of them, kind of a psychosocial evaluation, both psychological things and social things. Are they going to have enough money to get by? What sorts of disabilities do they need to apply for? Are they depressed? Are they suicidal? A lot of people with AIDS are depressed, and most of them think about suicide, at least think about it. We think that probably people with AIDS commit suicide more than people with other kinds of terminal illnesses, but that's something that will be proved in the future.
Jerry, as a volunteer, do you remember your first day at the project? What was that like?
Well, actually, Lori, my first day at the project, there was almost not a project because I'm one of the oldies but goodies of this organization. I started in December of '82, and the project itself had only started at a meeting about 6 weeks before that. I went in to train to work on the hotline, and we were trained through a kind of an interesting process called active listening, which deals with working the crisis situation and helping the individual kind of work through what their problem is and formulate their own course of action. And very shortly after that, I started on the hotline, so I was there through the media blitz when the Newsweek cover really hit, and it kind of came very strongly into the public consciousness. And then I, shortly after that, started giving talks for the project, and then I got into the hospice program.
Let me ask you a question about the hotline.
Shoot.
What kinds of questions did you find at the beginning, and has it changed along the time?
Yeah, in the beginning there was an enormous amount of panic. Within the gay community, particularly initially, the word of this had started to filter out from New York, and there was so little known at that time that people were just in a state about everything. They didn't know if they could catch it from a drinking glass or whatever. Also, there was so much misinformation, and some people would have a cough and think, "This is it, I'm dying." So you were not only dealing with the specifics of the disease, but with the perception of the possibility that they might have it. Or I remember one call I had was from a mother in Ohio who had called all over the country and couldn't get anybody to really talk with her. Her son was in UCLA and was about to be discharged. He was an AIDS patient, and she wanted him to come home, but she was terrified about her family. So you had everything from that kind of really gut-wrenching situation to people who want to know if they could get in a jacuzzi with somebody that they suspected might be gay or might have AIDS.
Yeah. I understand, Colleen, that one of the top priorities for the project is to get at least another social worker. And I can understand why from what you're saying. You have a lot of volunteers that help you. About how many?
Well, we have 50 people that work with people with AIDS one-on-one. We have a lot of psychosocial volunteers, which are psychiatrists, psychologists, licensed clinical social workers that lead groups, see people in individual therapy. Groups are real important to people with AIDS. Many of them find them very helpful to have somebody to share information with. On the other hand, groups are real hard for people with AIDS because they get in a group with someone and who they may become very fond of, and then that person dies. And that's real hard. It's hard to, to make new friends and watch your friends die.
As a volunteer, and you've been a volunteer for a long time, have you felt that burnout?
Yeah, there's an enormous amount of attrition throughout the project. There's just no getting around it. Basically, what I do at this point is supervise what we call the buddy system, which is what Colleen was mentioning. When someone comes in for an intake, they're offered a whole range of services, one of which is what we call a buddy. And that can range from anything like helping with transportation or just going out to a movie or something very casual, but it's a commitment that is ongoing, and it's one-on-one, so it can become a very emotional attachment. It can be real hard to watch the deterioration.
That leads me to my next question, really. I know that a lot of people who have AIDS are abandoned by their family and friends. I'm hoping that you can maybe explain why a little bit, and also tell us about how you are able and not able to fill in that need.
There are certainly a number of people who fit that classic nightmare pattern that you keep reading about in the papers. My experience has been that it's just such a traumatic experience that very often the support system may in fact stay fairly good, but over a period of time they need help filling in the gaps. They need some breathing space.
Yeah.
I think it's probably that way with any terminal illness, but we try to fit in wherever it's necessary.
In the beginning, I think the friends are often there and they help. But as time goes along, they kind of think, well, I've done my duty, and they drift off. And that's extremely painful, I think, to lose people that you've been friends with forever. and to, I don't know, maybe Chris, you could talk about that a little bit.
Yeah, especially the longer that you're sick and the longer you've survived that sickness, people have a tendency to, in the beginning, be real compassionate. And then there's a total denial that comes after compassion. And in my case, having gone into a remission and not stayed in a visible sickness, there's been lots of denial from friends and from family, and lots of drifting away. And I feel that if I had been visually sick, that there would be a lot more compassion, or if it was a quick illness, there's a lot more compassion.
Tell us a little bit about what the first months were like for you. I mean, just that whole process right at the beginning.
Right at the beginning was real difficult to deal with. You wake up one day, and I woke up, I wasn't feeling well, went in and had some swollen lymph nodes and had biopsies done and was diagnosed with KS, which is cancer. And my immediate reaction was, at that point, this was back in November of 1982, there wasn't that much knowledge about AIDS, and if you contracted AIDS, you died. And that was all that was known. So my initial reaction was, well, it's all over. And I started going to UCLA on a study program and got lots of reactions from friends, and AIDS hadn't even gone into the media blitz stage at that point, and the media hadn't become aware of it. Most people weren't aware of it, and within my first few months of diagnosis, the media had become aware of it. And it was a real scary point, because you're dealing with a sickness, you're dealing with your own emotions, whether you're going to live or die or what you're going to do, set your priorities as to how you're going to deal with something. And at the same time, when you turn to those people, your friends and your family, that normally would give you lots of love and compassion if you're sick. And it's not like you go up with a life-threatening disease and you have a heart attack or you have any life-threatening disease. Usually people have lots of compassion in their eyes. As soon as you're diagnosed with AIDS, that compassion turns to fear. And it's a fear of the unknown or a fear of a stigma that's attached to it. And people just don't know how to react. So my whole support system was kind of upside down.
You were part of the initial group of people using the drug interferon. Can you explain what that is and what the effects are and all that kind of thing for us?
Sure. When I first started, it was alpha interferon, and it was a study program at UCLA. And went and spoke with the doctors, and you're offered, would you like to try this program? And, well, what other options do I have? You really don't have another option. There's a couple different treatments, and take A, B, or C, and I chose to take the interferon. And at that point, it was an in-hospital treatment, and I was on it for a year, and that was spending every other week as an inpatient in the hospital getting an IV treatment. And there were side effects, and for me, I got real good results and went into remission. Sorry to say, it hasn't worked that well on most people that it's been tested on. And there's
What happened to the people in your study group?
Most of the people in my study group have passed away. And there have been other study groups and different types of studies done. And it's real frustrating to see people that you've known and loved die all the time, and to feel you're in the same position.
What do you do for yourself psychologically as you see people?
Psychologically, there's a lot of denial.
Yeah.
Purposeful denial.
Yeah, definite purposeful denial. I kind of shelter myself from seeing what I don't want to see, or not seeing what I don't want to see. And I go to therapy once a week.
That's real important in terms of the support system that you have.
Yeah, therapy is real important. In the first 6 months that I was diagnosed, I was going to a group therapy. And as I believe Colleen or Jerry was saying earlier, it was just too difficult because half the group had died. And by now, I think out of 8 people, there's like 3 people that are still living. And it's real difficult to deal with.
Well, in some ways, you're somewhat of an exception. Your case is a miracle in a lot of ways, yes?
Yes, I am the exception. A miracle, I don't know.
What's it like for you today, and how does the AIDS Project play a part in your life right now?
The AIDS Project plays a big part in my life. I first went to the project back in the winter of '83, so it was only like in existence maybe 5-6 months, if that long. And at that time I was looking for support somewhere where I wasn't getting it. I wasn't getting enough from family and friends. I needed more, and I needed to know more about AIDS and AIDS issues, and started getting involved with the project. And they sent, when I was in the hospital, they sent a buddy over to me, and he came in with plants and flowers, and it was real nice, welcome change. Instead of, nurses and doctors coming with gowns, gloves, and masks, and people being afraid to touch. And from that point on, I started getting quite involved in the project, and became the person with AIDS liaison to the steering committee and the board of directors, which directs the project. And so for the last year and a half, I've been very heavily involved in the project, and am now on the board of directors as a liaison for people with AIDS, and do lots of input.
That's great. Let me ask you one other thing, Jerry and Colleen. If someone wanted to get involved, what kinds of things do they need to know? What kinds of things would they be doing, and do they need special training, and what do you need?
Well, at this point, we offer such a range of services that just about anything they have to offer we can use.
They can do anything.
Literally, there's so much to be done, and as you mentioned earlier, there is an enormous amount of burnout. So we're constantly looking for new people and constantly training new people. I work with the buddy system, which is may possibly be the hardest in that it's the most emotional.
And probably one of the most rewarding. Colleen,
Yeah.
I hope you get your social workers, and I congratulate you on your wonderful work. And Jerry, you too. And I'm hoping that a lot of people will come and work in the buddy system and in all the other volunteer programs that we have. And Chris, continue good health and keep on going with the project, because I know that it's a real important service. Thank you all again, and join us again soon for another update on the AIDS Project Los Angeles and the community action work that it does.